You're listening to Vet Candy.
Welcome back to Brainsmarts, the show where two barely qualified comedians try to keep up with the people who are actually saving lives.
Yeah, we bring the jokes, they bring the brains. It's called balance.
Today's guest is the reason your cat stopped licking itself bald. We're talking dermatology, baby.
That's right. Joining us straight from the land of cowboys, college spirit, and serious skin smarts, Texas A&M is Dr. Christina Gentry.
Dr. Gentry is a board-certified veterinary dermatologist. The translation is, she knows everything about itchy pets, weird bumps, and why your dog's ear smells like a corn chip left in a sauna.
She's also a clinical assistant professor at Texas A&M, which means she's molding young veterinary minds and still finding time to speak at WVC Vegas.
Vegas dermatology. I bet that's the only conference where you can say, what happens under the microscope stays under the microscope.
She's a DVM, a member of the American College of Veterinary Dermatologists, and has a special interest in feline allergies, otitis, immune-mediated skin disease,
and client education. So basically, she's making the world a little less itchy, less smelly, and a way more informed place.
Please welcome the queen of clean skin, the professor of paws, the dermatologist with the derm-a-lot, Dr. Christina Gentry. But first, a word from our sponsor.
We'll be right back with more Vet Candy.
Hey vets, 2026 is your year. Time to put yourself first, starting with your CE plans. That means leveling up your skills and having an adventure while you do it. Enter WVC Vegas, the ultimate mix of CE, hands-on labs, and unforgettable Vegas experiences. Network with leaders, boost your career, and sneak in some shows, spa time, and iconic Vegas vibes while you're at it. You deserve it. Skip it, and you'll be watching everyone else make connections, master new skills, and explore Vegas while you stayed home doom scrolling. 2026 is your year. Don't miss out and live your life to the fullest. Register now for WVC Vegas, February 14th through the 18th, and make it happen. Pack up your bags. We are going to Vegas.
What? Welcome to the show!
Thank you so much. That was probably the most exciting introduction I think that I have ever had at any conference or anything. That was wonderful. I got to get a copy of that.
Yeah, pretty good once you cut out all the outtakes.
Which the audience will never hear.
Unless you join our Patreon.
Well, welcome, Dr. Gentry. Thank you so much for joining us.
Thank you for having me. This is really exciting.
This is really cool. So tell me, why dermatology specifically? Because not only did you go to 4 years of vet school, you went to even more school.
Yes. Yeah, I signed up for a lot. I think for me, I realized middle of my veterinary school time, for maybe around third year, that not only am I squeamish of my own blood and people blood, but I'm a bit squeamish of veterinary blood. And I think that generally when I say that out loud, people think that's not really compatible with being a veterinarian, I would say. So for me, when arteries or veins are really squirting, like there's pumping blood, like you're getting sprayed in the face, I have to tap out or I'm going to hit the floor. And when I did realize that in third and fourth year, I still really enjoyed the idea of veterinary medicine and I enjoyed working up cases and problem solving. And as it turns out, when you like problem solving, but you're scared of a lot of blood, you have very finite options to consider.
Sure.
Right? You can do general practice and say, I don't do surgery, which there are plenty of awesome GPs that don't do surgery. So that was on the table. I had considered radiology, but I'm scared of the dark. So that wasn't really a great choice. And then there was ClinPath and Histopath, and I really love pathology. It's a large part of dermatology, but involves necropsy, also squeamish.
Yeah.
And then I kind of thought, okay, well then maybe it's just between dermatology and internal medicine. And I was in my fourth year in the beginning, and I had a patient that had come in overnight for screaming in pain. And it was a husky. And I think if anyone knows huskies, they know that they scream on a whim. And so it was kind of hard to tell how painful the dog was. But it came in, and because it was screaming in pain when you touched its back, there was an assumption that it had neurologic disease, which is completely reasonable.
Sure.
And so I was a student on the case, and I was doing my student physical exam that it will then be done by a bunch of other people that know what they're doing better afterward. And I noticed a few little red sores on its back, and I just made a casual comment about it to the resident. And they said, yeah, that's weird. Let's take it down to dermatology before we go in the MRI. And I was like, cool. This sounds fun. I hadn't been on Derm yet. And we walked down, and Dr. Adam Patterson, who is still a professor at A&M and is amazing, and my coworker now, which is super fun. And he was there, and he looked at the dog, and in like 30 seconds, because he's really good at his job, he was like, oh, this is, of course, post-grooming folliculitis and furunculosis. This dog does not need an MRI. This dog needs antibiotics and some NSAIDs. And I was like, oh, this is amazing. Like, how did he do this, right? Like, it was impressive. I mean, he really is incredibly smart, but I was like floored as a student, like, wow, this is the ticket.
Now, you said frunculosis?
Furunculosis, isn't that a great word? That has a good mouthfeel.
That does.
It's very Seussian.
I feel like I might accidentally summon something if I try to pronounce these words.
So what that means in real speak, for those that maybe aren't in the veterinary field and are somehow listening to this, is it's an exploded hair follicle. So, right, when you get like an ingrown hair, it really hurts, right? And it's really inflammatory. So think about the idea of having a bath gone wrong, which is how this usually happens, where you have exploded hair follicles all along your back. Like a third of your body is covered in exploded, painful hair follicles. That will make anyone scream in pain. It's awful. Gives them fevers. They feel really bad, but it's a readily treatable condition. And because he picked up on it so fast, the dog didn't need an expensive MRI this time. Who knows what it did later, and was able to get really acute treatment because we were in a multi-specialty teaching hospital where you can ask all the right people if a question comes up. And so after that event, I was like, dermatology, internal medicine. This guy knows what's going on. This is pretty cool. And so I kind of moved into that direction. So that was kind of why I said, yep, this is the specialty for me.
That's awesome. That's so cool. I love dermatology too. I very briefly for about like 5 minutes very seriously thought about going into dermatology because I love cysts and like acne and stuff. And then I was like, yeah, nah, do that. I can't do that.
I mean, the idea of human dermatology terrifies me. But pets, I don't mind like how gross it is, how smelly it is, how much scale is shedding. I mean, sometimes like the more the merrier. Like I get really excited about it, which is not a normal reaction, but it means I'm in the right place for my job. So yeah, I'm all about how gross it can be. But whenever we have to do some cross training and look at human textbooks, it's
really,
yeah, it makes me go, yes, I love veterinary medicine. I'm in the right place.
Humans are gross.
Humans are kind of yucky, and I cannot look at a rash on a person, but the idea of a rash on a dog just sounds like a fantastic Wednesday type thing.
That's awesome.
We do have a dog that smells like Fritos.
He does. I actually gave him a medicated bath earlier today.
See, look at that. Dermatology for the win. Less Frito-y for everyone.
That's right. That's right. And he hates his baths, but he feels so good after. Yeah. And then he sleeps so good because he's not so itchy.
We got him from a shelter, and his previous owner wasn't treating his condition in any way.
He looked awful.
It got really bad. Pretty much the only hair on him was on his front paws and his head. And
he looked like a creature. Yeah, he was not
furry from what I saw.
Well, I think you saw Panzer.
Yeah, that was Panzer.
A different dog. But he did regrow a lot of his hair, but there's a lot of spots where it just never came back. It was permanent damage. And he's just bare skin now.
It's kind of cute though, because it almost looks like he's just not wearing pants. You know, like the cartoons where they're wearing a little t-shirt and no pants. So tell us, okay, so you've been to Vegas before.
I have. I was lucky enough that I was able to go last year. And I went last year because IDEX, who I connected with the year before that, had sponsored my trip there to do a lecture for them on one of my favorite topics, otitis, talking about how improving our cytology skills and using little tidbits from cytology, not just the overall, is it bacteria use, but smaller things that you can see on cytology can help you make different clinical recommendations for your patients.
Sure. Yeah, that's awesome.
All right. Well, are you ready to answer some questions?
I am ready to do my best.
I think you got this.
All right. Well, before we get started, let's hear from our sponsor.
We'll be right back with more vet candy.
Hey vets! This February, it's WVC Vegas, probably the most unforgettable veterinary conference you'll ever attend. Hands-on labs, must-see lectures, and networking with the people who could actually shape your career. All in Las Vegas. Skip it, and you'll be watching your colleagues make connections, crush sessions, and explore Vegas adventures while you scroll through their stories. Your brain, your career, and your FOMO collide in Vegas. Register now for WVC Vegas, February 14th through the 18th. Don't get left behind. Sign up today.
All right, folks, we've roasted cats in bow ties, judged dogs for their Wi-Fi habits, and mourned over the rise of avocado toast-loving pups.
But now it's time for the moment you've all been waiting for, our Brainsmarts Fur Baby Challenge.
And lucky for us, we have the ultimate guest to tackle these questions. A real-life veterinary superhero, WVC Vegas speaker, and dermatologist extraordinaire, Dr. Christina Gentry.
She's seen itchy cats, drama-filled dog ears, and even the occasional overzealous, kale-fed puppy. Let's see how she navigates the wild world of fur baby culture and maybe school us along the way.
Dr. Christina, are you ready? Your brain versus our ridiculous fur baby questions starts now.
Question 1. Why are veterinarians worried about the rise of fur baby culture? A, because pets are demanding emotional support humans. B, because people are giving their dogs spa days, avocado toast, and health insurance. Or C, because treating pets like tiny humans can lead to unnecessary treatments and animal welfare issues.
I'm going to go with C.
C is correct. Because while we love our fur babies, Fluffy doesn't need Botox, a gluten-free diet, or a therapy journal. Overtreating pets can actually make them sicker. Plus, it's hard to take a cat's blood pressure when it's wearing a onesie that says Mama's Little Angel.
Although, let's be completely for real, I would buy our cats a onesie that say Mama's Little Angel. But I would take them off before they went to the vet. Question 2. According to the article, what's one big downside of fur baby thinking? A. Pets are losing their sense of independence and refusing to get jobs. B. Owners are choosing expensive or unnecessary treatments instead of focusing on the pet's quality of life. Or C. Dogs have started requesting organic puppuccinos with oat milk only.
I'm going to go with B for this question.
B is correct, because sometimes what's best for the pet isn't the fanciest surgery. It's a little perspective and maybe fewer oat milk lattes. Remember, just because something's called gold standard doesn't mean your cat wants the platinum plan.
And I will just say that is why there has been a really big push lately in veterinary medicine to discuss spectrum of care, which is kind of care across the spectrum for every time point in the patient's life for not only financial, but physical abilities versus time available to do things. So love it.
Absolutely. There is no one size fits all.
Question 3. What did the experts say might actually give some dogs a better quality of life? A. Letting them join a street gang of village dogs who nap and share snacks. B. Sending them to obedience school in Switzerland. Or C. Giving them unlimited screen time and an emotional support hamster.
I'm going to go with B.
The answer is actually A.
Fantastic.
Apparently those chill village dogs who hang out in packs and live like furry freelancers are sometimes happier than pampered designer pups left alone all day. Moral of the story, freedom, friends, and fresh air beat couture collars every time. I mean,
because like I wouldn't let our dogs join a gang. Our dogs are a gang, but like an outside gang.
But if you said, take your dog outside to roam freely and where you know the boundaries of the park are, I'd be like, yeah, that's amazing. Independence is good, but not a street gang.
Yeah.
I think the point they're trying to make is like, if you get a dog as an accessory and you just set it somewhere and don't interact with it, it would be happier just being not having an owner at all. Yeah, just being wild.
All right, Dr. Christina, we've survived the fur baby quiz without getting barked at, but now it's time to level up.
That's right, because if dogs could talk, the game would change forever. Imagine your pug giving a TED Talk on why you're a terrible roommate.
So, in honor of our canine companions' hypothetical voice boxes, welcome to Talking Dog edition of Brainsmarts. Dr. Christina, are you ready to separate fact from fantasy and maybe save us all from the future sass from our pets?
I am ready.
Brainsmarts, Talking Dogs edition. Question 1. According to the review, why might dogs never fully talk like humans? A. Their vocal cords are too busy singing along to TikTok. B. Anatomical and cognitive limitations make human speech nearly impossible. Or C. They're secretly plotting a global takeover and don't want to give away secrets.
I'm really hoping the answer is B, or I'm going to be really worried.
The answer is B. While dogs are amazing communicators, their anatomy, jaw, tongue, vocal cords, plus brain wiring just isn't built for human-style sentences. So don't expect your corgi to recite Shakespeare anytime soon, though the secret takeover theory is cute.
Question 2. What's one key benefit of studying how dogs communicate today? A. To finally get them to complain about your taste in music. B. To better understand canine social cues and cooperation. Or C. To teach them sarcasm, because everyone needs a sarcastic golden retriever.
I'm going to go with B again.
B is correct. Even without full sentences, dogs have a rich language of barks, body postures, and eye contact. Learning their cues helps us improve welfare, training, and our ability to avoid stepping on paws. Literally.
Question 3. Why do researchers suggest we maybe not try to make dogs talk like humans? A. It's basically asking for a judgmental Yelp review from your Chihuahua. B. Dogs communicate just fine in their own language. Or C. Because dog lawyers would start suing for free treats.
I'm going to go with B again.
B is correct. Dogs are already excellent communicators in their own way. Trying to force human speech could stress them out, and honestly, a tail wag or well-timed bark is way cuter than a critique of your driving skills.
You know, honestly, for one, maybe this is an unpopular opinion, I'm glad our dogs can't talk.
That's true.
Because we let our dogs into our solitude, man. Like, they come to the bathroom with you. They get in the shower with you. They sleep in the bed. Like, they know everything.
Yeah, you don't want them running their mouths.
No. All right, Dr. Christina. We've tackled fur babies and even debated whether dogs should start critiquing our Spotify playlists.
But now we're entering a new frontier. Dogs literally slowing aging. Yes, apparently man's best friend might be the ultimate fountain of youth. Move over, kale smoothies.
So, Dr. Christina, grab your stethoscope and your anti-aging cream because it's time for the Service Dog edition of Brainsmarts. Let's see how much you know about dogs, PTSD, and the science that makes us all want a dog training side hustle.
Brainsmarts Service Dogs and Cellular Aging Edition. Question 1. What surprising benefit did female veterans experience when training service dogs? A. Their telomeres got longer, suggesting slower cellular aging. B. They suddenly started speaking fluent dog. C. They developed the ability to sniff out snacks across the room.
I'm going to really hope it's A.
A is correct. Training service dogs wasn't just good for the soul, it actually helped slow biological aging at a cellular level. So apparently, wagging tails equals anti-aging. Dogs may not give you wrinkles-free selfies, but your cells are quietly thanking them.
I wish dogs gave us wrinkle-free selfies. Question 2. Why might simply watching dog training videos also help veterans? A, because passive dog watching is the new yoga. B, the structured attention and engagement reduced psychological stress, even without hands-on training. C, it allowed them to master zoomies without leaving the couch.
B, please.
B is correct. It turns out even just watching the dogs learn tricks gave the brain a stress break. Science says it's the attention to routine that helps, not just fur-covered personal trainers. Bonus, no fur in the couch cushions.
Question 3. Why do researchers suggest service dog volunteering might be especially helpful for female veterans? A, because dogs are excellent listeners and will never judge your karaoke skills. B, it combines emotional healing with meaningful work without the burden of ownership. Or C, it's basically a free pass to boss around adorable pups.
I'm going to go with B.
B is correct. Training service dogs gives emotional support and a sense of purpose. Plus, it's less stressful than full-time pet ownership. Your cells thank you, your dog-loving soul thanks you, and bonus, no late-night poop duty.
To be without the late-night poop duty. All right, Dr. Christina, we've slowed cellular aging, imagined talking dogs, and survived fur baby shenanigans.
But now we're entering a slightly less cute territory. Raw cat foods that might be plotting against us.
That's right. A new Cornell study found deadly pathogens lurking in commercial raw cat foods. Because apparently your cat's frozen chicken nuggets could double as a microbiology lesson.
So, Dr. Christina, get your gloves on, metaphorically at least, because it's time for the raw cat food edition of Brainsmarts. I said that like it was gonna fire off like the Daily Double sound from Jeopardy.
Maybe it did.
I'm pretty sure that's copyright. Let's see if you can spot the danger before anyone's immune system files a complaint. Brainsmarts, Raw Cat Food Edition. Question 1. Which of the following pathogens were found in commercial raw cat foods according to the Cornell study? A. Salmonella, Chronobacter, E. coli. B. Tiny dragons that grant wishes if you cook them just right.
Oh.
Or C. Anti-aging fairy dust.
I'm going to go with A, although why would we cook the tiny dragons?
See, that's what I think too. I just want the tiny dragon. I would start a tiny dragon rescue.
I'd start a tiny dragon circus.
Aww. I'd rescue tiny dragons from your tiny dragon circus. We are a house divided.
The correct answer is A. Yes, real scary microbes were detected. While dragons and fairy dust would make feeding cats more magical, the real danger is that these bacteria can make both cats and humans very sick. So no tasting tests are allowed.
Question 2. Why are freeze-dried and raw cat foods especially concerning? A. Because cats might start speaking in bacterial tongues. B. They often lack warning labels that they may contain live, potentially antibiotic-resistant bacteria. Or C. They come with free Tupperware, which is suspiciously trendy.
I'm going to go with B.
B is correct. Freeze-dried products might look safe on the shelf, but live bacteria can lurk inside. So while your cat thinks it's a fancy gourmet meal, your immune system is on red alert.
Question 3. What's a key takeaway for pet owners feeding raw cat food? A. Wash hands, sanitize surfaces, and maybe rethink sharing snacks with a cat. B. Start writing apology notes to the microbiome of your household. Or C. Set up a bacterial obstacle course for fun science experiments.
I'm going to go with A, but I would like to note that B also seems like something we should do.
Considering how deadly microbiology can be, maybe err on the side of caution and just write an apology note just in case.
Just have it on hand. It's not going to hurt anybody. Might help somebody.
But the correct answer is A. Proper hygiene is crucial. Those microbes aren't picky. They'll happily hang out on your hands, countertops, or even in your morning coffee if you're not careful.
Blech.
Bonus, nobody enjoys being an accidental host for salmonella.
And this is where I talk to pet parents about, even with reptiles like our bearded dragon, they carry that. You got to clean up if you put them on surfaces, and if you soak, you're supposed to soak them. So that's why we have like the special scrubber for the tub after the bearded dragon soaks, the special stuff. There's a reason for our chaos.
Brainsmarts Rapid Fire, This or That, Dermatology Edition. So this is real quick. There's no correct or incorrect answer. But we're going to ask you a series of questions where you have to answer without thinking, without trying to justify your answer. Which of the two, I'm not even going to say that you would prefer.
It's basically a would you rather. This or that. Don't think too hard, just say it.
Just say it.
Flea allergy or food allergy?
Flea allergy.
Cat ear infections or dog hotspots?
Dog hotspots.
Shampoos or topical sprays?
Shampoos.
Bald spots or itchy rashes?
Bald spots.
Laser therapy or cold compress?
Laser therapy.
Feline acne or puppy acne?
Feline acne.
Corticosteroids or antihistamines?
Corticosteroids.
Moisturizing wipes or medicated baths?
Medicated baths.
Telemedicine consult or just in-clinic exams?
In-clinic exams.
Only one treat or just a nibble?
Only one treat.
So, Dr. Christina, thank you so much for coming on today. We had a great time.
Thank you so much for having me. This has been an absolute blast.
This has been so fun. And we actually get to meet you in person in February at WVC.
I am looking forward to it. This is going to be my second time at WVC, and so I'm so thankful that I get to come back and talk about otitis, as well as doing a co-lecture with a veterinary internist at LSU to talk about endocrine disease from the both internist and dermatologist perspective.
That's awesome. We're going to have to see if we can kind of like sneak in on that one.
Yeah, I don't know how busy we'll be.
And that's a wrap for today's episode of Brainsmarts. Huge thanks to our incredible guest, Dr. Christina Gentry, dermatology wizard, fur whisperer, and official dog ear eye roller.
Seriously, Christina, thanks for schooling us on fur babies, talking dogs, service dogs, and rogue microbes and cat food. Your brain is basically a superhero cape for pets everywhere.
It's Vet Candy.
Vet Candy.
It's Vet Candy Radio.